Hi, I'm Dr. Kelly Starrett with H-Wave. We're going to talk about a really controversial topic, which is icing versus the use of the H-Wave when I have congestion or swelling or pain. Now look, without getting into the science and sort of arguing about the nuances of what's happening at a cellular level, I want to give you some rationale for why we have moved beyond icing and end up using H-Wave, especially the low frequency on H-Wave, to facilitate better healing and a more complete and speedy healing response. Oftentimes when we ice things, the ice itself, of course, is numbing, and that's great. We can get some on-demand pain relief with some ice. But our experience is as soon as our athletes take that ice off and they end up having sort of their tissues come back up to temperature, they end up having the pain come back. So it kind of gets us locked into this kind of constant cycle. The only time where I really get ahead is that when I'm icing and things are numb. And of course, numbing something isn't always the best thing to do. Now, one of the things that we love about using H-Wave is ultimately one of the reasons that we can be experiencing discomfort or pain after surgery or trauma or injury is that we've got localized swelling and congestion as a natural response healing response to the injury or the trauma, right? That healing response, that swelling is not actually a mistake. And ultimately, keeping in mind that our bodies were set up so that muscle contraction could move that fluid, those products, those broken down proteins out through the lymphatic system through muscle contraction, that's how our body was better adapted at handling sort of swelling events. Now, of course, elevation can work, compression can work too, but ultimately we're trying to do the same thing. How do we move those tissues, those fluids, through that lymphatic tissue, those vessels? Now, one of the things we get with H-Wave is that we have the opportunity to get a localized system to create a muscle contraction. And that muscle contraction moves the fluid along because it's squeezing those tubes mechanically. That whole sewage system, which is how we're handling that swelling response, is bootstrapped into our muscle system. Okay, so we kind of understand that, and the difference between being passive and throwing ice versus having this active system should be a clear difference there, that I can be managing pain more effectively because I'm reducing one of the mechanisms of my sensitivity, which is swelling. And oftentimes, when we help people get a hold of their swelling, we see massive decreases in their needs for pain meds, massive decreases in their sensitivity because the tissues aren't swollen. But there are a couple ancillary benefits that are really, really beneficial. Number one is that when we're engaged in that muscle contraction, what we're actually doing also is signaling to the brain that this tissue is safe to move. And that we know that pain is a really important signal to the brain trying to get us to pay attention to something, get us to change a specific behavior. And what we're trying to do, or the brain is perceiving what's happened to the localized spot as, hey, I need you to pay attention to this, or we're going to make this a painful situation. But one of the things that happens when we have movement in the system, we get a whole bunch, again, sort of secondary follow-along effects. One is that oftentimes when something is moving, I no longer can hear the pain signal. So one of the things that happens with a little bit of movement in the system is that it interferes with the messaging sort of in the spinal cord about what the brain can hear. And this is sort of this idea called the pain gate theory. And you've seen if you injure your hand or hit your hand, that shaking sort of stops that pain signal because the pain and movement signals are kind of in the same pathways. So one of the things that happens is when we're moving that tissue through non-fatiguing muscle contraction consistently is that we're interrupting potentially pain mechanisms that the brain might perceive. Now, remember, we're still trying to remove the decongestion, take the garbage out, bring the groceries in. That's an incredible part. Yes, increasing blood flow is important. Yes, removing the waste. But now we've got this movement system going on. The other thing that's happening is that because we're constantly moving and loading, and the brain doesn't recognize whether or not we're moving the limb or the muscles contractions, the brain thinks, hey, that's a movement system. We also start to tell the brain that this is safe to move this system. So if I'm constantly getting 2 contractions a second, and I run that for many, many hours, the brain starts to say, hey, look at all the movement happening in this system. So now we're de-threatening how the brain is perceiving what's going on. We've got movement blocking pain signals, and we've got this additional kind of actual physiologic response. We're moving the swelling out. The other thing that's so important is that the research is continuing to show us that long-term immobilization, even short-term mobilization, is really, really hard on the body, that we're really designed to be in constant motion. And so we need to find this fine line between protecting a tissue and not loading it in a way that's going to make it worse, right, to protect it, but also get some input in. And recent research has shown that even just 3 days of mobilization really does a lot to the quality of a lot of our connective tissue. In this situation, the tendon collagen. And one of the research pieces that just has come out has shown that even just 3 days of mobilization starts to show degraded organization of the collagen in the tendon. And so instead of having beautiful lines, we start to kind of be disruption, and we start to lose a lot of muscle mass. So immobilization plus ice is not moving, versus how do I get kind of safe movement in the system. So not only are we going to do all those other things, we're going to keep muscle mass on, we're also going to keep that collagen with a sort of signal that it needs to continue to be aligned. And as tissues heal, they actually need mechanical input to signal how that collagen gets relayed down. So I'm not talking about just holding on to your native collagen in your tendons, but also how does the body repair and heal? And when we look at the references of collagen, sort of scar tissue that's formed by the body in response to trauma that hasn't been loaded, it looks like a big kind of rubber band ball in a knot. And that the mechanical loading of those soft tissues shows us much better alignment because they start to organize based on muscle contraction. So again, we're not have to be moving and loading, but just any input into the system of isometrics or small movements tends to help that tissue realign more effectively. And we don't start to see sort of that conglomerated aggregation of tissues that end up being sticky and not sliding. So here's the case. We can injure something and ice on it and hope it just gets better on its own, or we can engage in natural, amazing input through muscle contraction that allows the body to do what it naturally does best. And this is why we have moved to H-Wave in our clinical and sport practices.